Hi everyone, this is Dr. Anand Mamdapur. I am the Senior Consultant and Head of Critical Care Medicine at Sakra World Hospital. Today I am going to speak about the stress in the ICU. The moment all of us hear the word of ICU, immediately we'll all be stressed because most of the admissions which happen to the ICU are unexpected, unanticipated. We are not ready for this admission psychologically nor even financially as well. It puts a lot of stress on the patient as well as the patient's family. And once they come into the ICU, they undergo a lot of tests, procedures, lot of days of ICU stay. In this context, the patient as well as the family is into a lot of stress. And once the patient is within the ICU, then he is away from the family. It puts a lot of psychological stress on the patient, and some of the patients do develop what is called as ICU psychosis or ICU delirium. Means a person was completely fine few days back, just because he is in the ICU, he is in that ICU environment, he is away from the family, there is nobody familiar to speak to him on a daily basis, to see, to understand what he wants. Even though there are doctors, there are nurses, there are paramedics, there are nutritionists, there are physiotherapists who are always there to take care of the patient, but all of them are not familiar to that person. So that person usually develops what is a condition called as ICU psychosis. So this is very common. A person who is completely normal starts behaving abnormally. Sometimes an elderly person behaves just like a child. So we take care of such patients, we console them, we allow the family more frequently to spend some time with the family. In case the problem is not under control, we also give them some medications to control them. So this ICU environment puts a lot of stress in multiple ways to the patient, to the family, and it is also for the medical profession a very stressful environment because somebody is entrusting their life in our hands, and we need to give the best of our services to get the patient out of the crisis, to keep the patient comfortable, to keep the family comfortable. At the same time, we take sufficient amount of time to counsel the patient and the family, because they'll be having a lot of questions, lot of doubts, because something goes wrong, they feel there will be hundreds of questions going in their mind. So we take sufficient amount of time to get the patient to a separate dedicated counseling room. We'll counsel the patient about what is happening with your patient, what is the problem, what are our plans, what are the likely outcomes. And ICU is also a very stressful area with respect to the finances as well, because it's very expensive affair. So in that context, a patient who has not prepared well, who doesn't have a good insurance, who doesn't have a good financial backup, but he has to support his relative with that financial support. So that patient, in addition to the medical stress, in addition to the ICU stress, they will be also having the financial stress as well. So we deal with all these things with the patient psychology day in and day out, and make sure that the patient as well as the family are given the update, precise, transparent, honest opinion about the patient's condition, patient's likely outcome. And in case the patient is not going to do well, then we'll tell them right up front that probably the patient is not going to do well, and we counsel them for some other form, what is called as comfort care. So in that context, ICU is a very stressful environment for all of us involved, right from the doctors to the patient as well as the family. Thank you very much.